guests and listeners, my greetings. I want to thank Global Network to Free Political Prisoners in Iran for inviting me to this panel, especially on this very important day, the World Health Day, to talk about such an important topic. Although the topic for today is about the medical deprivation of political prisoners in Iran, but I would like to emphasize that I want to dedicate my presentation to all prisoners who have lost their lives in Iran's prisons, regardless which prison or reason for imprisonment due to lack of medical aid and treatment. I would also like to thank the organizers for choosing the campaign, Don't Let Their Hearts Stop Beating. We are aware that the Islamic regime in Iran has and still deliberately does deny or delay medical help to the prisoners in order to eliminating them. The report written by CFFPI in November 2023 highlights the condition of political prisoners and exposes regime's practice of silently killing these prisoners by denial and deprivation of medical attention and help. My presentation today is about the short-term and long-term effects of these deprivation of physical health. We know that some of the illness, diseases, and symptoms need immediate attention and reaction and treatment. Symptoms which are related to heart or lung diseases, endocrinological diseases like hypothyroid disease, diabetic disease, neurological diseases like epilepsy, and cancer needs immediate attention, treatment, and any delay in treatment can lead to death. We read in the report, which is based on prisoners' own experiences, about the different methods used by Islamic regime, which is undoubtedly can be defined as silent torture, and some of them silent execution. We observe that in many cases has been, just give me a second, has been reported that the prisoners were medicated and sedated by cocktail of drugs, both in form of tablet and injection, which gave them anxiety, disturbed mind or confusion, hallucination or psychotic disorders, in some cases that has led to hospitalization and death. Some of those who survived these types of torture suffered long-term symptoms after being released, and in some cases, the prisoners committed suicide after their release. We are aware that the combination of some drugs like morphine and benzodiazepines can lead to bradycardia and cardiac arrest. This may be the main cause for some of the suspected sudden deaths which have been reported in 2023 and 2024. Prisoners who have been exposed to inhumane torture in form of rape have suffered of injuries in genital and anal areas, and in some cases leading to immediate hospitalization due to severe damage and bleeding to the mentioned area. Unfortunately, some of the victims didn't receive the treatment which was needed because of the security matter, and they were returned to the prison with false attest or declaration. Tolerating this kind of unacceptable torture methods have both psychiatric and somatic consequences for the victims. Physically, they suffer of pain, infection, damage to urinary, genitally, and the anus area, and psychiatrically has led to PTSD and in sad cases to attempting suicide or committing suicide. Diabetic prisoners have been reported being denied their insulin in their first few days after the detention. We know very well that in the case of such deprivation, the consequences are dangerous for the victims in form of hyperglycemia, mean high blood sugar, which leads to diabetic shock and ketoacidosis. In turn, this can cause damages to neurology system, kidneys and eyes, and in the worst cases, to death. Victims suffering with cancer are refused treatment either by postponing their temporary leave or total denial of diagnosis or investigation of the symptoms. Victims with heart disease symptoms needing immediate cardiac bypass operation have been denied getting permission for the necessary surgery. We are aware that this can lead to heart attacks, heart failure, and death. In many cases, it has been reported that the prisoners were transferring directly to the psychiatric hospital being treated with heavy psychiatric medicine, and in one available report with electroshock. We know very well that the electroshock is a type of treatment which gives usually to the patient with severe depression, and this treatment can lead to loss of memory. At the end, I want to refer to two laws. Nelson Mandela's rules. All the prisoners shall be treated with the respect due to their inherent dignity and value as human beings. No prisoners shall be subjected to, and prisoners shall be protected from torture and cruel, inhumane, or degrading treatment or punishment for which no circumstances whatsoever may be invoked as a justification. Principle 1, adopted 18th of December 1982 by General Assembly, Resolution 37/194, United Nations Human Rights Office of the Human Commissioner says clearly, health personnel, particularly physicians charged with the medical care of prisoners and detainees, have a duty to provide them with protection of their physical and mental health and treatment of diseases of the same quality and standard as offered to those who are not imprisoned or detained. This is exactly my point. In Islamic Republic regime, the physicians and healthcare personnel working in prison are equally responsible for the sufferings which the prisoners and victims have. Thank you so much.
Thank you, Kiana.